I know when you're taking on new patients or even when you're seeing return patients, you do a big comprehensive physical exam on them. And I know you're looking at kind of all the typical stuff, but are you also looking for symptoms of hot and cold or sort of those
Totally.
Chinese things? And which that's pretty much all I know about that is
Yeah,
that,
Meridian Theory too. I mean, I think it's all important. Yeah, I should have mentioned that actually. I appreciate you bringing it up because the physical stuff was also a really important part of my training because not only did I get like double anatomy, but I got even extra anatomy because all the acupuncture points are based on anatomical landmarks. So the space between points, the space between muscles, tendons, bones, whatever.
yeah,
And so the process of examination, it's hard for me not to think that or to feel that now. So feeling the meridians or looking at the meridians or whatever it may be. And yeah, and hot and cold is certainly a piece of that. So I'm always looking if their hands are cold or not. I'm always looking if they have blood pooling in their lower extremities, if they look in purple, or if they have poor venous return. I'm always looking at blood flow assessments, which I think have been really important and integral in the traditional Chinese medicine. But even just looking at their face, their constitution, what they call the shun, their spirit, so to speak, just seeing the person, there's a lot you can kind of see in the individual too. And those are very important principles that I think medicine's kind of long forgotten is, even the art of what I call the art of the physical exam now. I mean, there's always more I can learn about physical examination. I'm by no means like a crazy expert on it, but I'd say that it's missed, and especially after in this post-COVID era,
yeah,
a lot of times it's very abbreviated or not done at all. And I have nothing against virtual. I predominantly run a virtual practice, but I still see my patients whenever I can at a
yeah,
regular interval.
yeah.
So as quick as every 6 weeks or maybe 3 months or maybe twice a year. But in that time, it's incredibly integral. So yeah, the Chinese medicine really did help that too. I agree.
Yeah, I definitely seen how thoughtful your physical exams were, encouraged me to not cut so many corners on my physical exams. So again, I don't have that Chinese medicine background. I agree. It's good to get your hands on your patient, feel just kind of firmness of the tissue and see what's going on there.